producing annual clinical reports for decades, indeed probably over 100 years or 200 years in the case of the Rotunda. So not only do we have year-to-year information, we can actually plot the trends. At the moment in Ireland, the maternal mortality rate is somewhere between 8 and 10 per 100,000, and this compares very favourably internationally. For example, in the US, which has a much bigger proportion of GDP spent on a health budget, the maternal mortality rate is 17 per 100,000. In the UK, the maternal mortality rate is probably about 10 to 12 per 100,000, and similarly in France and throughout Europe. Scandinavian countries, again, about 6 to 8. So while there are differences in developing part of the world, we have actually very low maternal mortality, although there are small differences there. It's not 99% of maternal deaths occur in the developing world, where maternal mortality rates can be as high as 350 per 100,000 in any one country. And that's quite a staggering figure. In terms of maternal morbidity, about 2 women in every 1,000 pregnancies will have a very severe maternal morbidity. So by this, we define particular morbidities like massive obstetric hemorrhage, clot, venous thromboembolic disease, uterine rupture, etc. So we have a list of very severe morbidities, and again, we keep a record of those. And indeed, we keep a record nationally now through NPEC, which is a group based in Cork, which retain national data. And again, we have trends. And if I was to comment on one trend in Ireland, it would be the rise in hemorrhage. And that's what worries me most as Master of the Hospital, is the increasing instance of postpartum hemorrhage, particularly. The other really striking trend in terms of maternal morbidity is, of course, the increase in maternal age and increase in maternal obesity, all of which have significant impact on delivery and risk.